Hey everybody, Dr. Rice here from Health Pro Chiropractic in Burnsville and Rosemont, Minnesota. So today we're talking pregnancy, all right? So if there were a way to decrease labor times by 24% and potentially decrease pain medication use by 50%, you'd have to be crazy not to investigate that a little further. Would you agree? I think most women would probably say, heck yeah, I would love to decrease my labor by 24% on average, and that's what we do with chiropractic, and that's what has been shown. Women that are under active chiropractic care during their pregnancy experience those benefits, and the way that that happens is through what are called the 3 Ps. The power of the contraction, the passageway, where that soon-to-be-born infant is going to be going through, and the passenger itself, the infant that's going to be born. So chiropractic addresses the nervous system through adjusting the spine and removing interference, all right? So we know that the pelvis is what, that baby's gonna be passing through. So if there is misalignment, subluxation, fixation with the way that that pelvis is moving or not moving, in the case that we're talking about, it would make sense that we would want to make sure that those joints are functioning as well as they should, so that when that infant does presents to go through that passageway, that everything is moving so that they can create enough room for the infant to go through. So the other thing is the power of the contraction. So your uterus is just a muscle, all right? And muscle is controlled by nerves, all right? So if the nerves that are getting to the uterus are being interfered with in any way, we want to make sure that we're removing that interference and improving that coordinated function between the brain and that particular part of the body. So that's what we do. We locate where the interference may be, make those adjustments, and create more coordinated communication between the brain and that particular part of the body. All right, so the next thing, the passenger, that soon-to-be-born infant. So the uterus, which is what the infant is inside, is tethered to the bony pelvis through different ligaments, okay? And those ligaments, they're kind of like cords, and they've got like a fixed length to them. They can stretch a little bit, yes, but if the pelvis is out of alignment, it's going to create some uneven pulling on that uterus. So that can create an abnormal presentation of that soon-to-be-born infant. And if we can make sure that that alignment is as good as possible, we can help to ensure that that infant is in a proper presentation to go through a normal labor and delivery. So that's how chiropractic addresses pregnancy, and that's through what's called the Webster technique, which is what we are certified in here at Health Pro Chiropractic. So if that makes sense to you and you're going to be pregnant in the future or are right now, give us a call. We'll get you checked. Have a great day.